Today we'll talk about very important topic, that is sports medicine. Namaste. I am Dr. Krishna Poddar, Senior Pain and Spine Specialist. It is very important to make this sports person fit because they get repeated injuries because of the sports they play for. They get sometimes small injuries, they get the ligament injuries, the muscle tears, they get the tear in the small muscles, joint injuries, sometimes even fractures. The important thing, they have to come fast to their sports. Otherwise, if they will suffer injuries, they can't play. It will be loss for them, not for them only, our country. So, being a doctor, being professional and being pain specialist, it's my duty to make them happy, healthy and fit to play. So these injuries can be very frequent, can be acute, like sometime playing and they have the trauma or injury. You have seen many times when there is an improvement and someone is making the century and that just before last ball and he will get it. Or maybe he is going to make a goal and he will just have the injury. And sometimes it is a chronic. That means people are playing because of that regular action of that joint, they get the chronic tear or chronic spasm, chronic pain. The most important thing is the diagnosis, because by seeing that they are very strong, sometimes they can't complain so much, they don't complain, so we don't know what the injury is, because of this injury what happened to that joint or that muscle or that ligament and tendon. So for the diagnosis, first we have to assess them, we do X-ray, or most important is the MRI. MRI scan is the gold standard. We do the MRI, we find out what is the cause. And then one more very important model is the ultrasonography. Because in MRI we see what is the fixed structure, but some structure we know about the tear. If their muscle is moving, then only we know where the tear is. That time the role of ultrasound is come, because ultrasound we can do during movement. So if we move the hand or leg, and that time we do the ultrasound, so we can know where exactly site and what type of the injury is this or what type of the problem is this. So ultrasonography is very important. Being pain physician, we are expert in the ultrasound. So whenever the patient comes or sports person come, we, after asking the history examination, we do the ultrasound, dynamic ultrasound, and know the exact what is the nature of the problem, cause of the problem, and where it is. It is very do the diagnosis, then comes how we can make them fit very early and we can repair their joints. So for that we have the different modality. The most important modality I will say is that is a mindfulness or yoga. If you are in the yoga, mindfulness or meditations or deep breathing exercise, then you can even avoid all this thing, and the healing comes from the mind also. Then second is the regular exercise program, rehab, and I am very sure this sports person, they have the rehab person who is making them to do all the rehab exercises, and they are always fit. But now it is important to repair the problem or the injury site or the where the problem or tear is there. So for that, what we have the treatment modalities, we don't require the surgery most of the time. 90% of the time we don't require the surgery. How we treat? We treat with the or the minimum intervention, pain and the spine intervention, that is a MIPSI. Under ultrasound or the under X-ray or the fluoroscope, we do some interventions where the injury, either injecting the prolotherapy, or most important is the now platelet rich plasma or PRP therapy. If there is a muscle tear or tendon, if we give this PRP under ultrasound, the healing occurs very fast, and here patient's own growth factor or the stem cells which are inside the body, they heal. Then we have the stem cells, which from the bone marrow we take out the stem cell and we do the treatment. But sometimes injuries are different, like if the pain is coming from the spine, we need a spine intervention. Sometimes these facet joints are responsible, like I have treated one of the international cricketer from our neighboring country, from the Bangladesh. He had this facet orthopathy. He came to me. We did the radio frequency of this facet joint, by which he become fit and he is playing cricket. So we can do this if there is a slip disc also, because it also occurs very frequently in a sports person. So with the MIPSI we can treat the slip disc also, and we don't have to cut or do the surgery. We can always do there are different modality of are available with us. With that we can heal this sports person, we can make them fit, and they can again play for our country. If you want to know more about all this thing, you can connect to me always. You can visit our website, it is available in the website also, and you can call us also. Thank you.